Hello, I'm Philip Moses, Specialist Surgeon at Veterinary Specialist Services. So, following surgery, we keep our dogs in hospital overnight. We monitor them very, very closely. All of them will have a dedicated nurse who sits with them for 24 hours while they're in hospital. We'll feed them a little bit the morning following surgery after they've had something to drink, and generally they'll go home in the afternoon, the day following surgery. When they go home, it's very important to keep a close eye on them. If you notice any increased difficulty with breathing, any vomiting, any diarrhea, or you have any concerns whatsoever, it's really important to contact the team at VSS straight away. If it's after hours, then our friends at the Animal Emergency Service are here and they're always available. So things to watch out for are any increased effort with breathing, having difficulty breathing, increased airway noise, any vomiting, any regurgitation, or any concerns whatsoever. It's important that they don't rub at their little noses the day after surgery. The sutures we use there are very, very fine. They're not meant to be removed. They're actually inside the nose. But because the sutures are so fine, they're not particularly strong. So if dogs do rub at them, they can open the little wound up there. Generally, we recommend that dogs have very soft food for the week following surgery, either little balls of meat or mince or canned food, or if your dog's used to dry food, you can soak some dry food in some warm water for 15 or 20 minutes until it turns into a soupy delight for them to lap up. Some dogs will be back to normal in a day or two, others will take 3 or 4 weeks. It is a very major procedure. Improvement can take, for the airways, 2 to 3 weeks, sometimes a little longer, just while all that swelling in the back of the throat there resolves. But generally by 4 weeks post-operatively, they're breathing very well. Gastrointestinal signs, if they're present, such as vomiting or regurgitation, can take a bit longer. Typically they'll take 2 to 3 months to resolve. And if they haven't resolved, if we're still having regurgitation and vomiting 2 to 3 months after surgery, we may need to investigate for a hiatal hernia or a reflux problem. The other procedure to discuss really is the laser-assisted turbinectomy, which we'll sometimes do. In some dogs, the nasal turbinates are quite excessive at the back of the nose and block off the airflow, and if that's the case, they may need to be removed with a laser. We typically wait 3 to 4 months after the traditional surgical approach before we'll consider late surgery or the laser-assisted turbinectomy, just to allow everything to settle down and make sure that your dog does actually need the late procedure. Regarding the Hemi Vertebra, if your dog does have Hemi Vertebra, even though they're neurologically normal when they're seen and when we assess them, it's very important to watch them very closely for the development of any neurological signs. So if they become painful in the back, wobbly in the back legs, unable to get out of bed, or you have any concerns, please contact us straight away. Typically, spinal problems need to be treated very quickly. So if you have any concerns at all, contact us immediately.